name is Tom Longo. I'm here with Dr. Keith Radbill. He is our medical director over at Renew Us. We have asked some questions and have some questions that patients have asked us throughout the past couple of months here in regard to testosterone replacement. So we are here to answer those questions for you, and we will kick it off with, what is testosterone?
Okay. How you doing, Tom?
Good, how are you?
Good, good. So testosterone really is a steroid hormone. And when we hear that term steroid, really it just means a molecular structure. A lot of hormones in the human body, they have this steroid structure. It can become a corticosteroid like cortisone. It can become testosterone, which is considered anabolic, which builds up. That's what that term means. And we think of it as a male hormone, but it is also, men and women make testosterone, and it's really vital for numerous functions. It's not just for libido or sex drive. It has metabolic effects on the entire body, on every single organ system. So it's essential with regards to youth, and it's also essential in aging, and it's very related to the process of aging.
Okay. So one other question that we had from some of our patients is, why would people want to get testosterone replacement therapy?
Okay. Well, that is a really important question, and I could probably give you 100 answers for that. We can look at it as when we're young, when we're 20 years old, when we're at our peak. If we can look at our bodies internally, our joints are healthy, there's no arthritis, our coronary arteries are without any plaque, they're pliable and rubbery and they're healthy. And then as we get older in age, all these things deteriorate. That's the process of aging. In addition to metabolically, after age 40, type 2 diabetes, high cholesterol, hypertension, these things don't happen when we're young, when we're 20. They happen as we age. And one of the things that are associated with that exactly is loss of hormones, specifically testosterone and other hormones. It basically is a line after age 30, aging and loss of hormones, like that.
Okay. So you also mentioned peak. You mentioned a peak in testosterone levels. So you said when you were 20 to 30 years old, you were at a peak in testosterone. What would a normal lab for that peak moment look for a male and a female? Because you said both women and men also have testosterone, right?
Yeah, I like that question, because if you look at a lab, we're traditionally trained, and we're taught in medical school to look at every lab. It has a reference range from here to here, and what do we tell patients? If it falls within that spectrum, it's normal, right? But just because something falls within that reference range, it has nothing to do with normal. The reference range is really just a statistic that says that 95% of us fall between this number and that number. And in school, we're really taught to optimize everything. So let's say it's your blood sugar. If it's your blood sugar and the fasting blood sugar range is 80 to 101, and you fall at 100, are we going to say that's normal? Well, we might if we're very busy and we don't have time to sit and discuss it. But in reality, you'd be much better off with a blood sugar fasting of 81 than of 100, even though they're both in the reference range. Now, nowhere is that more evident than with hormones, and specifically testosterone. So every lab, which is kind of funny, has a different reference range for testosterone. One lab will have it between 250 and 900 in men. Another one has 350 to 1100. Everyone has a different reference range. But if it falls, let's say the reference range I like to go by with regards to testosterone is really between 350 and 1100. But if you're 40 years old and your level is at 400 or 450, you're really falling around the 10th, 15th percentile, maybe even 20th at best. So that means that 80% of men between the ages of 17 and 80 are higher than you. And if you have symptoms of low testosterone, such as fatigue, body aches, low libido, increased abdominal fat, these are symptoms, then being in that reference range towards that 20 percentile is not good. Just like the blood sugar. You want your blood sugar or another, you can think of this in terms of every test. There's an optimal range, whether it be the bottom, the top, or the middle. With testosterone, the higher the better, because the higher you are, the less you're aging, the healthier your body is and the less risk factors for comorbidities and complications and cardiovascular disease.
Okay. So there was one question from a patient that said, is this related to the fact that I've been going to the gym? You know, he's been going to the gym for pretty much his whole life since he started working out. And now it just seems like no matter how hard he works out, how good he eats, he still cannot lose weight and build muscle. So I'm just assuming the fact that it's because his testosterone levels are lower, that he has increased abdominal fat, like you were saying.
Right, and you know there's so many factors that influence that. There's genetics. There is how you take care of yourself, your diet, exercise. I do have one patient who does not receive testosterone. He's 67 and his testosterone level is 900, and he's possibly the healthiest human being I've ever seen, especially at that age. He's lean, his lipids are excellent, his blood sugars are perfect. He just works really hard. But there may also be a genetic component to that as well, because you're saying your friend, he exercises, he eats well, but he still may not have that level of 800 or 900 that this 67-year-old gentleman does. So what's going to happen is, and this is one of the most common complaints I think any doctor hears, is a patient comes into the office, let's say it's a 45-year-old male, and he says, I'm just tired, I don't have the energy, I'm not sleeping like I used to, I can't focus like I used to. And what do we do as physicians? We say, well, let me examine you, take a history, and do your blood work. And we get the blood work done, and it comes back a week later, we see you, everything's good. Your cholesterol might be high, some little things here and there, maybe their sugar is getting elevated, and we treat whatever those issues are. The problem is, we're not getting that patient feeling any better. And the patient says, well, is that going to help me feel better? And reality is no. So traditionally, we're going to say, we're going to put the onus on the patient. Well, you need to exercise and eat better, but what do the patients say? Just like your friend. I'm following a Mediterranean diet, I'm exercising 5 days a week, I have a lot of stress in my life, I work, I have a family. So now we have something that we can give patients to help them to feel better, not just feel better, but make them healthier. Testosterone replacement therapy, when done properly, is extremely safe. It reduces heart disease, because this is a fact. Men with low testosterone have more heart disease. Men and women with low testosterone have more diabetes, type 2 diabetes. They have more Alzheimer's disease, and in men they have more prostate cancer, which I'll get into in a little bit as well.
Okay. Yeah, so you kind of hit the nail on the head there. I'm getting a little bit older. A lot of my friends are getting a little bit older, and now we see that the effects. We're getting a little bit more tired. We're not able to exercise as we used to, and I guess it's a fact of a lower amount of testosterone in our body. So we went over a little bit. You touched a little tiny bit on the health effects of low testosterone, and you talked a little bit about heart disease.
Right.
Do you want to go into a little bit more detail on that?
Yeah. So numerous studies have shown that, again, low testosterone increases risk for heart disease. Another study showed men with congestive heart failure who have lower testosterone have a worse outcome. Prostate cancer. This is really a controversial one, but I can say this as a fact that men with lower testosterone get more prostate cancer. One of the thought processes about prostate cancer, and this is a fear of many doctors, is that if we give someone testosterone, won't it make their prostate cancer grow faster, or won't it possibly start prostate cancer? And the answer is absolutely not, except under a certain situation. So, for example, testosterone will not increase risk for prostate cancer. It will not make prostate cancer grow. However, there is an odd situation. If somebody has prostate cancer that has already spread, that is the one patient you don't want to give testosterone to. But in that case, it's already spread and they need therapy. So one of the things I mentioned was Alzheimer's disease. Lower testosterone levels have been shown to increase Alzheimer's disease and certain other neurodegenerative diseases. So what we want to do here is we want to get people, we talked about the levels before. So let's say, for example, in a male patient, we'll talk about 45-year-old male, he's coming in, like I said before, he's tired, he has lower libido, he may have put on a little weight in his 40s and have that belly, and he gets his blood work done and the blood work shows that he's healthy. His lipids are higher than they were when he was 30, blood pressure may be up a little higher, and testosterone is obviously lower. So all these things are linked together, right? As we discussed before, after age 30, testosterone drops every single year, and aging is exactly correlated with that. So when we replace the testosterone in the healthiest way possible, you don't want to take testosterone orally. We mainly use subcutaneous pellets here. So when pellets are put under the skin, we usually do it in the gluteus region or in the back, there is zero liver metabolism, which means there's no effect on blood clots. One of the fears of testosterone traditionally, there was a study in 2015 which put a warning on testosterone may increase risk for blood clots. Well, when this study was looked at, it was completely erroneous. The stats actually showed a decreased risk for heart disease or for blood clots. And over 30 societies have submitted to the AMA to remove that labeling, and for some reason they don't, and I can't understand why, but we do have numerous studies, one which was done at the University of Texas in Galveston, 30,000 men, no increased risk in blood clots in men receiving testosterone. So we know that it's safe. So we get back to that 45-year-old man. His testosterone level, let's say, is 350, on the lower side, and definitely what I would expect in a blood test coming back. We put this person on testosterone. We bring their level up to maybe 800-900. Well, what's going to happen? The first thing they're going to notice is their abdominal fat is going to decrease, because this is a direct result of low testosterone. Type 2 diabetes and insulin resistance. Now, you don't have to have type 2 diabetes. Again, we talked about a whole range with regards to labs. So your blood sugar is creeping up. You're pre-diabetic. We hear this all the time. We tell it to patients all the time, and we tell them to watch their diet and exercise. But, you know, a huge culprit is the low testosterone. We get their testosterone level up. Now their insulin resistance is reduced. Their blood sugars are going down. This is proven. Their abdominal fat is decreasing. What are some of the side effects? Well, besides the fact that their libido is increased, they feel better. They're sleeping better. They're focusing better, you know, at work and at home. They're going to have less body aches. You know, testosterone therapy has been shown to decrease the symptoms of osteoarthritis and rheumatoid arthritis. And why is that? We mentioned before that testosterone is a steroid molecule, okay, or a steroid hormone. Well, steroids traditionally can be anti-inflammatory. We know about cortisone. The problem with cortisone is it can be catabolic, meaning it helps in the beginning, but it destroys the body over time. Testosterone, which is also anti-inflammatory, so anything inflammation related, joint pain, even heart disease, which is an inflammatory process, is going to be reduced. And except it is not catabolic, it's anabolic, which is actually a good thing. All anabolic means is building up. So you're going to build up more muscle, decrease abdominal fat, decrease inflammation, you're going to feel better. Can we say that we're going to stop aging? No, we haven't figured that out yet. There are many studies on different medications, even metformin is being looked at in rats right now, but it will not decrease a person's lifespan. We know that. We think that it may help. We have to prove that, but we know that the quality of life from that point on, from when that person starts therapy, is dramatically improved. I could give you 100 anecdotal stories of my patients, but that's not what we do in medicine. We don't talk, I started this and I felt better. You need studies. And there are numerous studies to show that this is true. You're going to feel better, more energy, less inflammation, better sleep, better sex life, better everything. And it's not just in men. You know, we briefly mentioned women. So women, you know, in men we call it andropause. And again, aging in men is just linear, like this after age 30. And it just is that way for the rest of their lives, correlated with the drop in testosterone. In women, it's very different. Menopause or perimenopause, after age 30, they age like this, and then there's that 5-year perimenopausal period, it's like that. And then the rest of their life, it follows along with men. So this is really important. Prior to that time, women have a much lower risk than men of heart disease. We all know this. Women live longer. Also, what happens during that dramatic loss of hormones, estrogen, other hormones, progesterone, testosterone, bone density loss. I mentioned testosterone, it is a bone builder. It can increase bone density 8% each year that somebody is on it. And women get osteoporosis, they become 65, 75. They lose those essential hormones, their bones become brittle, they get fractures. So aging again, in women like this, then there's that dramatic time, and then after that perimenopausal period, their heart disease risk equals that of men. 5 years before, way less, 5 years later equals. Hormone loss. So what can we do? Well, with hormone replacement in women, it got a bad name in the 90s. I started in medicine in the mid-90s, and I remember there was a big push with FDA-approved hormones. The ones we use, Premarin and Provera for women. Premarin is an estrogen, Provera is a progesterone. And we were told these are FDA-approved, and they were good, and they will reduce osteoporosis and heart disease and breast cancer and all this. And of course, in 1999, a study came out that showed increased risk of heart disease, increased risk of breast cancer, increase in Alzheimer's. And we were like, wait a second, that doesn't make sense. Then in 2001, the big study came out, and it showed definitely there was an increase. But what we didn't realize at the time, we're traditionally trained, everything that we do should be FDA approved, right? And we need the FDA, it's really important. But I don't want to say that they're not always correct, but we know, for example, with the opioid crisis, the FDA has told us that Oxycontin was not addictive, and we know that's not true. Well, these medications that were FDA approved, Premarin, is a horse estrogen. It's obtained from horses. It says it on there, equine. It's also oral. When we take a hormone orally, which is not good, and I don't want any of my patients to do, it gets absorbed and it goes to the liver, and the liver is where all the clotting factors are made. So that's where the problems begin. So number one, you're taking a synthetic hormone, right? You're taking it orally, it's going to the liver, it's increasing inflammation, which, as we said before, inflammation increases heart disease, cancer, everything bad. And it goes to the liver, and we wonder why these problems are increased. But we know that if the hormone is given properly, subcutaneously, and it's a natural hormone, the natural estrogen that women make, E2 is 17-beta estradiol. That's what we use. It's not the estrogen that goes down the pathway for increased breast cancer. So there is no increase for breast cancer. There's no increased inflammation. There's no increase in blood clotting because it's not being metabolized by the liver. There's zero liver metabolism. So now we get to what else in women? Testosterone. So women, we talked about levels, the reference range. Women do have a reference range for testosterone in the labs. However, there is no established, this is where a woman's testosterone should be. I've seen one lab, it's 12 to 82. Another lab, it's 20 to 45. So there is no established reference range. But we do know that when we replace testosterone in women, their libido obviously is increased. They sleep better, they feel better, they have less joint pain and body aches. It gets rid of abdominal fat. They can focus better, and they're much happier in many ways with their lives. But the thing is, we want to do it the healthiest way possible, which is natural hormones, subcutaneously. You can also do it topically, but the effects are not as significant.
Awesome, thank you. It definitely answered a lot of our questions that we've been getting from patients. And again, if you guys have any questions, please comment on this video, and we will make another video unless we can get Dr. Radbill to just comment on those comments or reply to those comments online. It would be great. You touched on a lot of things in that last session. I just wanted to then go over again. You mentioned the oral progesterone and estrogen.
Yeah.
So one of the common questions that we get is, can we take over-the-counter supplements? So over-the-counter supplements to help with testosterone levels. I mean, you already mentioned some of the issues with some of the things, but please go ahead and answer that question. So over-the-counter supplements for testosterone replacement, are they okay? Do they work? and what might be the risks or side effects that would possibly go along with those over-the-counter supplements?
Yeah, that's I get that question a lot, and there's really not a lot of information. So obviously, they're not allowed to sell testosterone or estrogen or hormones over the counter, but they make these supplements, and we see them advertised on TV. I see a baseball player, my testosterone booster, and how they're supposed to work is all hormones are really run by the pituitary and the hypothalamus in the brain. The hypothalamus tells the pituitary to tell whatever organ that is, whether that be the thyroid gland, whether that be the ovaries, whether that be the adrenals, or the testes, to make that particular hormone. So the thought is, if we give that person a pro-hormone, which are usually peptide, safe molecules, it's going to tell them to make their own natural testosterone or their own natural estrogen. And we don't have any evidence that that works. On large scale, there really aren't any studies to back that. But again, I will say this, if you're taking one of these supplements orally, we just don't know what the effects are, because remember, most things when taken orally, they get absorbed, they go through the liver, and that's why so many medications you'll see have more liver metabolism than other. We always see interactions between medications. Why? Because this one will have this effect, the liver enzyme will break down this a little more, or another medication will increase that effect, and it may become toxic. There's so many things with regards to medicines. We would assume that the same would apply to any supplements. And I'm not against supplements at all. It's an interesting field because there are many vitamins and supplements that we need, and I believe in. Like, we do need omega-3s, and we do need certain vitamins, excess amounts of, like vitamin D. It's good to take vitamin D. We're traditionally low in vitamin D levels, and that increases bone loss and heart problems, and now we hear with COVID to keep your vitamin D levels up, CoQ10. We are not against taking anything, supplements orally, but we just wanted to be back with some science that shows that we need this particular item. I frequently tell many of my patients to take niacin, but this can help with the good cholesterol to raise it higher. It can also help with a very bad cholesterol particle called lipoprotein A, which 1 in 5 people have, and we need to test for it. And I don't mean to go on a tangent, but I'm a big believer in this. That being said, don't take niacin unless told by your doctor, because it can have negative side effects too.
So as you can see, and I'm sure people who are watching this already know, Renewis is not just hormone replacement. We go through the whole patient. We do blood test samples. We do have review, which is a metabolic test, which can show what your metabolism is while resting. We do a DEXA scan, which can show your bone densities and other things. So Dr. Radbill really treats the whole patient here, and our main goal is to get you feeling better, get you feeling back to your optimum self. So one more question we have from some of our patients is, how long, if I start the treatment, if I start testosterone treatment, how long do I need to be on it? Is it forever? Is it only for a couple months? Please go ahead.
I love that question. It's my favorite question because I like answering it. When I was first trained on this, I will never forget my first patient. I was putting subcutaneous pellets. It was an 80-year-old man, and he was so fit. And I thought to myself, this is how I want to be when I'm 80. So the gentleman hopped up on the table like it was nothing. And he was thin, and he was fit, and he was happy, and he was virile. And I didn't know too many 80-year-olds that were like this. And I asked him that question. I said, how long have you been doing this? And his answer to me was, not long enough. I said, well, what does that mean? He says, 8 years ago. He started when he was 72, and he's been on it for 8 years. And he says, I golf, I fish, I'm active. He sends all his friends to this facility to get this treatment. And he really was happy. And so when my patients ask me that question, I say to them, well, let's say you start when you're 45 and you're feeling great and you're staying fit and you're playing tennis and golf and fishing and being active and having a great sex life. When you feel that you want to be old, let's say you hit 75, you know what? I don't want to feel good anymore. That's when I'm going to stop. And of course, when you stop, that's when all these processes are going to start to affect us. You'll, again, increase abdominal fat, your blood sugars will go up, you'll feel the effects of aging much worse. I did want to say, you know, we have so many patients here that not just subjectively say, boy, I feel so much better, and they're very thankful, and I appreciate that, but that's not why I do it. I just love to see the quality of patients' lives improve. I always say in primary care, because as a primary care physician, if we're doing a really good job, we're never going to hear it. Just because somebody's not going to have a heart attack or not going to have a stroke, you're never going to know that if they don't have it, you know. And but with this, we actually get to see the improvement on not just subjectively from what they tell us, but on paper. We almost always see their hemoglobin A1C, which is an important blood sugar test. It drops. We almost always see their bone density go up in DEXA scans in females when we check before and after. And it's just really great to see their health improve. Their weight comes down. They're more active. Quality of life is everything. And what is aging with a poor quality of life? There's, you know, it's just depressing. But when we can see patients improving, it really is rewarding on our part. And you touched on, you know, what we do here, and you know, as far what we do, we're not all about hormone replacement. That's just one small aspect, but the patients can continue it for life. There are no adverse reactions of continuing this indefinitely. There are some cautions, and we do have to watch certain things. Nothing is without its negatives that go along with the positives, but they're very easily managed. But really what we do here is, I think, a form of internal medicine, primary care, hormone replacement. We want our patient, we want to tackle what really is causing morbidity and mortality, whether that's high blood pressure or cholesterol or blood sugar or cancer, you know, screening all our patients, making sure we're doing preventative things, making sure we're getting everyone on a Mediterranean diet rich in antioxidants, making sure that their labs are not normal. I don't want normal, I want optimal. So if you're not getting that opportunity with your healthcare practitioner to sit down after your blood work is done and go through every test, and instead of just seeing nothing that has H or L, high or low, and they address those two tests that are out, address all of them. The ones even that are in the reference range. Well, yeah, your hemoglobin is in the range, but it's not where I would like it. It's too high. That thickens your blood a little bit. Or your cholesterol, it may be good, but it could be great. You can extend that to any test, whether it's kidney function, liver function. It's just, and if we can really optimize everything, and when we involve the patients in their care, as far as sitting with them for a half an hour and going over these test results, they really get involved in their own care. By just telling a patient, you need to exercise, you need to lose weight, you need to follow this diet, here's a piece of paper with the diet, it almost never happens, because we know that, and that's been proven in medicine, that to get people to change their ways, this is not a knock on us, it's because we're human beings and we don't have control over everything in our lives. Maybe there's a 10% that we can say you need to lose weight and they lose the weight, but that doesn't happen. This is a great time in medicine because we have newer medications for weight loss that are safe and that are long-term and that improve heart health, and we can utilize these medicines. Unfortunately, we do get a lot of difficulty with insurance companies covering these medicines, but hopefully they'll see the forest through the trees and realize that prevention will, that allowing us to treat these ailments will prevent disease later, which we know it does. Just to get the insurance company to go along with that is a difficult one, but our goal is just to really get people their healthiest and feeling their best, and for as long as possible.
Absolutely. Thank you so much, Dr. Radbill. As you can see, he is very passionate about what he does, and patients tell us that all the time, that they really enjoy the time. He does take a lot of time with his patients to go over blood tests and to go through and make sure that they're doing everything correctly. And as he said before, preventative medicine is definitely one of the biggest things to prevent all these other diseases and issues that we talked about earlier today. Again, if you have any questions, please comment below. Please subscribe to our YouTube channel. That's so you can get more updated videos. Every time we do a video, it'll notify you that there's a new video online. And not only do we do videos on hormone replacement, we will do videos on anything, on weight loss, on preventative medicine, whatever expertise that he has, he will share. That's why he's here. That's what his passion is. So again, thank you, Dr. Radbill.
Thanks.
And we appreciate everybody watching. If you have any questions, again, please comment below. Go to our website, renewus.com, or you can give us a call at 888-210-3054. Again, 888-210-3054. All that information will be below. Thanks again. Everybody have a great day.
Thanks, Tom.
Yeah, appreciate it.